Hey guys, it's Catherine, one of the 4 original Chillies in a pod. I just wanted to make a little video sort of to update you on everything that I can remember and sort of let you know about an experience I've had recently which relates to everything. So at the minute, the UK Just Giving page is up to over £800, which is like absolutely amazing. So I just want to say thank you to everyone for that. The Irish and the US pages are doing phenomenally as well. So I'll be speaking to Nicola, Lindsay and Brenda and getting them to attempt to do one of these videos as well, just to let you know how that's all going. But yeah, so we've got a few Chilli warriors that have joined us. So we've got Camilla, Noreen, Jade and Simone. They've all joined us as well as part of our little team of ME warriors, hoping to help you all to get a bit of more awareness raised in different parts of the country and the world, and to keep pushing for everything. So the experience I've had recently, I was telling the girls about it, and some of them have just asked me to let you know what happened. So basically, oh excuse this, my cat Bella, you might remember from my original video, she scratched me earlier, so yeah. But you may remember that on some of the pages we've been discussing the fact that we don't support graded exercise therapy and cognitive behavioural therapies as cures or sort of treatments for ME. So when I went to my doctor, because I was really poorly and my energy levels were beyond what they've lower than they've ever been, and I finally got referred to an ME clinic here in England. So I was really excited. I was absolutely buzzing about the chance to potentially get some help financially, physically. The opportunity perhaps to not have to work as much was raised as well. But when I got there, things were definitely not as I had been informed. So I had, before I got there, they sent me like this little envelope, well an A4 envelope, with a questionnaire in it, which asked all different questions, like to do with what I could do on a normal day. Did I feel from my original diagnosis like that things had got harder or easier to do, or if they were the same, you know, the kind of things I'm mentioning. But a good 4 or 5 pages out of these 12-page booklet thing was about my mood levels and things like that. Now obviously our moods are affected, but I did feel like it was starting to gear in a different direction. I filled it all in anyway, took it with me and went for this original consultation. So I sat there, I was introduced to this lady, not told whether she was doctor or basically what kind of medical professional I was speaking with. So sat chatting away to her. She pretty much informed me that the only way I was going to get help was to miss like 1 day a week of work every week, which for me isn't financially viable. I can't do that. I can't be missing work unnecessarily, and for me that was unnecessary. To attend a group meeting, so like a support group, or I could have one-to-one help, but that would be 3 times a week and I wouldn't have any other choice. So for me, neither of those were an option. They're both within working hours, and that was the only options that they could give me. They couldn't give me any other options, which I struggled with a little bit. So I tried to talk about it, ended up that we ran over the time, and then had to go back for a second consultation. So went back for a second consultation, and I left in pieces, absolute pieces. This woman same woman as I spoke to the first time, informed me that they would not help me to work out who I needed to speak to financially, but she gave me a number to ring, which was for the Yorkshire and Leicestershire kind of. They don't deal with the East Midlands, they deal with the very, very outskirts of Lincolnshire and Leicestershire, on the northern side. So it was all a bit off. Then she basically said that due to when the situations around the times that my symptoms changed or that I developed new symptoms, she believed I needed psychotherapy, that I was not fit to be classed as having ME. So I left in floods of tears. She forced me to phone my GP, book an appointment for that day to be signed up for level 4 therapy, psychotherapy. So I went to my GP, spoke to my GP, and, well, my GP knows me well enough to know that that's not true. GP is very aware of everything, knows that I'm ill, has stated that it's very clear that I'm ill, and basically said that, you know, just needed to change some of the medications I'm on to sort of rebalance my mood, but I shouldn't go back. Now, when I then went back to my GP a couple of weeks later for like a medication update, I had received a letter from the clinic that I went to. Now, this letter stated that the person I spoke to is a physiotherapist. Now, I'm not qualified medically. I have no medical training, bar first aid. I have nothing. But as far as I'm aware, physiotherapists are not fully qualified on ME. They have no medical background with regards to that. Now, if I'm wrong, I do apologise, but I don't feel that it's right that we are being sent to physiotherapists to make a complete and utter overall medical judgment call as to whether or not we have this diagnosis. We know our bodies, we know them better than they do, and unfortunately, when they have no actual medical, biological knowledge, and all they know about is the therapies, it's very difficult to be able to explain that, to explain yourself and your situation to somebody. Now, I am absolutely infuriated by this situation. When I answered the question, how much do you know about your illness and have you ever researched it? I responded with, yes, I know quite a bit about it, purely because I've had to go and research it, because everybody I've ever spoken to has no idea what I have. She put in this note on this like form that she was then filling in, similar to the one I filled in prior to going. Sorry, I've had a chest infection. She then filled in on this form hypochondria. So yet again, modern day 2015 medical professional genuinely believes that I have hypochondria and mental illness rather than a physiological autoimmune disease. It's not good. It's not great. So I just wanted to let you guys know that this is just another reason why we need to raise these funds, to do all this chili eating, spread the word, get all this funds raised, and just generally fight for our rights, because even in this day and age, in the UK, in the Western world, people still have no idea and aren't really that bothered. They'd rather pass us off than give us the help we need. So, yeah, guys, just make sure that you're still telling everybody, re-nominate everyone on your friends list, get tweeting, all sorts. Snapchat. I got a Snapchat from someone the other day nominating me for the challenge, or not realising that it was me that was part of setting it up. So that's awesome. The word is spreading. So just, guys, just make sure you're doing all that. Get people to donate. And, yeah, it's still as hilarious as it was the first day we did it. So thanks, guys. Love you all. Bye.